history of their first, second, and third relatives of having lineage of like ovarian cancer, prostate cancer, or a history of breast cancer, they are at lifetime risk of developing the BRCA gene mutation, either one or two. These two, I'm thinking of it, I'm so sorry. So 6 and 10 will have, I can't really see, mutated BRCA gene 1, and 4 and 10 will have mutated BRCA2 gene, and 1 and 10 will have normal BRCA genes.
So as Kelly said earlier, the likelihood of developing BRCA1 and BRCA2 gene mutations, it does increase by the following lifetime risks, where 40 to 80% for breast cancer and 11 to 40% for ovarian cancer. So those are actually the two likelihoods of developing cancers. Like the majority is breast and ovarian cancer. However, if males are affected, they can also get male breast cancer, and up to 39% can develop prostate cancer. As far as the BRCA mutation, it does increase the risk of cancers, where for women by the age of 50, 33 to 50% can develop it. By the age of 70, 56 to 87%, and then ovarian cancer. And then the blue is the general population that would develop the breast cancer.
Who is affected? I'm going to butcher this name, I'm really sorry, but Ashkenazi Jew, Dutch and Icelanders. Region of the world is Central or Eastern Europe. Breast cancer is commonly found in women, however, men may develop it as well as the BRCA gene. There are no noticeable clinical signs and symptoms of the genetic disease. The life expectancy on a relative 5-year survival rate, and this is if you are diagnosed with breast cancer, is stage 1, you have, if it's 0, it's 100%, stage 2, 100%, or stage 1 rather, 100%, stage 2, 93%, stage 3, 72%, and stage 4, that's 22%. It's important to realize that these statistics are based on the cancer when it's first diagnosed.
Some of the symptoms as far as developing BRCA1 and BRCA2 gene mutations, there really is no early signs and symptoms of having the mutation. However, there are late disease symptoms where late onset of screening for the BRCA1 and BRCA2 gene mutation and also being diagnosed with breast cancer can lead to the cancer metastasizing to the lymph nodes and or other organs, which could ultimately lead to death. Some of the possible complications associated with being diagnosed with breast cancer, along with having the gene mutations, could be lymphedema, changes in the skin due to radiation, fatigue, pain, metastasize, and reoccurrence. So again, there really is no signs and symptoms for early gene mutations. However, if the patients are diagnosed with breast cancer, then that's when the symptoms really start to show.
Most people, sorry, it's okay. Most people who like say their sister comes in and they are diagnosed with breast cancer, they'll come in and want to get genetic testing for that because there is some type of family history, so they're at risk for it. Or say that their mother got diagnosed and now their sister or their aunt got diagnosed. They're more at risk for this gene.
So in order to determine if you have the BRCA genetic mutation, you could do genetic testing, which would consist of either blood or saliva test. And as you see here, Angelina Jolie, she really made this genetic testing big now, and now there is more, now people are more aware of the actual genetic testing and how it can help you in the long run if you are at high risk, or if you know of like family history of possibly carrying this gene or having breast cancer, then that's when she chose to get genetic testing. And we do have a short clip on it.
How do I get hotel deals? Nobody else gets.
I've priced it a little bit.
You don't mind the ad. This is how we get
Commercial
paid.
break. Sorry.
Sexy.
I've been doing this for 20 years. Can I get an upgrade? Never overpay again. Seriously?
I'm trusting you. Exclusive hotel deals up to 60% off. Priceline.com.
Well, genetic testing is actually a very easy thing to do. It's very easy to see if you have a BRCA1 or 2 mutation. It's a simple blood test. It's just a few vials of blood, and it takes about 3 weeks to come back. What's difficult about the test is it's hard to know who needs it, and it's not inexpensive. It's about $3,000, and some insurances pay, some insurances don't. So you really need to know that you're at high risk or that you need the test before you go out and have it. Right. You know, one of the first things I do when people come in, I ask them about their family history. Do you have a first-degree relative, mother, daughter, sister, anybody who's had breast cancer? We look at their ethnicity as well. People who are of Ashkenazi Jewish descent are at incredibly high risk of having the gene. People of Scandinavian descent also are more likely to have the gene. But it can pop up in absolutely anyone. So we really rely a lot on family history of breast cancer or ovarian cancer in the family to decide who really should be tested. At that point, I send to a genetic counselor. They do more in-depth questions, and then finally they can refer you for the test. The test is very reliable. You either have a positive or a negative. A very small number of people end up with ambivalent results. I think the harder aspect of the test is what to do after. You know, if you find out that you don't have the gene, well then great. You might still be at a high risk of breast cancer, but you're not in that tremendously high risk. Angelina Jolie, I mean, I guess based on her genetics and maybe some other family history factors that we might not know, her doctors thought she had an 87% lifetime risk of getting breast cancer. She clearly decided to be proactive rather than reactive, and she took this drastic measure of a double mastectomy to lower her risk. She says she now has a 5% lifetime risk of having breast cancer. So that's one thing you can do. But a lot of people, in fact most people who test positive for the BRCA mutations don't have a double mastectomy. They opt instead for just very, very close surveillance. They'll have an ultrasound or a mammogram or MRI on a regular basis, even every 6 months or so that if they do develop breast cancer, it can be treated early when it's most curable. I think there are people for whom the test is less urgent. If you have no breast cancer in your family history and your behaviors don't necessarily raise your risk of breast cancer, or there are people for whom it's not necessary, although just last month the Supreme Court actually started to hear an argument about whether or not the patent should be lifted on the test to make it more affordable. I do think once it's more affordable, more people will get it, and that can be a good thing.
How do I get hotel deals? Nobody else gets.
Alright. So again, as she said there, genetic testing can be complex. The results would affect the healthcare recommendation. So if it's positive, you would opt for either a double mastectomy, or she said you could also opt to just closely survey it. And really it's your decision if you want to undergo genetic testing. It's completely up to you. Just like Angelina Jolie, she decided to do that on her own. And the test results aren't completely straightforward. I mean, it is either positive or negative, but there is more to it. And if you are interested, then definitely talk to your a specialist in cancer genetics, a genetic counselor also, if you're interested in genetic testing.
So the medical management for affected individuals with BRCA genetic mutations is you can have prophylactic bilateral mastectomies, and the example is Angelina Jolie. She opted to have to not have to continuously surveillance her breast every 6 months and check in and make sure. And it depends on the person. If they have that gene, do they really want to be worrying about that, try to sleep at night and be woken up with nightmares thinking that they have breast cancer? So that's when a lot of people opt to have a prophylactic bilateral mastectomy. Medical management for unaffected individuals, so those without the BRCA gene. Close surveillance and self-examination and annual mammograms and MRIs. Ovarian cancer, add surveillance options for ovarian cancer screening.
So again, Angelina Jolie's decision. She says here, the truth is I carry a faulty gene, BRCA1, which sharply increases my risk of developing breast cancer and ovarian cancer. So pretty much her history is that her mother did battle breast cancer and then later developed ovarian cancer at age 49, and ultimately she did die of the disease at age 56. Also, her grandmother did die of ovarian cancer as well at age 45. Her maternal aunt died of breast cancer. And so looking at her family history, you see she does have that breast cancer, ovarian cancer, very high risk. So that's why she chose to have a bilateral preventative double mastectomy. And that's why she initially opted to have that genetic testing to see if she did have that gene mutation. And it says here she plans to have her ovaries removed once she has decided that she doesn't want any more children. However, a couple weeks ago she did undergo surgery to remove her ovaries. So she did get that done as well.
So for those that do the opt for the prophylactic mastectomy, there's 2 different ways that you can reconstruct a breast again. And one is the implant-based breast reconstruction. It's a 2-part process. So you have surgery with the first stage of tissue expanders, and you come in after the first week and they find a port with a magnet X marks the spot, and they stick a needle. They put about 60 cc, about 2 ounces of fluid into the expander, and you come in 1 to 2 weeks and keep doing that for about like 3 months, and then you have your second stage implant-based breast reconstruction where you remove the tissue expanders and place in the permanent implants. It is fairly quickly, like within like 6 months you can have this all done and reconstructed. Oh, this is a picture. So this lady had a mastectomy. You can see her scar. This is her after picture. You can see her scar right here. That's where the mastectomy was. And she has implants in. They don't really show pictures of when they have the tissue expanders, but they're very hard devices. They're not very comfortable, and they're actually sutured into the actual chest wall, just because they have to be so hard in order to stretch the skin. So autologous is your own tissue, so it's basically your own fat. This is kind of nice for a lot of us, I'm sure. It's one of the ones that I know of is a DIEP flap. It's deep inferior epigastric perforator, and it's excess skin, fat and tissue, basically from your lower abdomen that they take. They don't take any of your muscles. You don't lose any core strength, and they reconstruct it with your breasts. And you can do it at the same time as mastectomy, so you don't have to go through the tissue expander phase. Only very few, obviously, can do this because you have to have enough tissue to reconstruct the breast, but you can. Here's a picture of it. So this is a patient that was before, and this is her after, and this is with her own skin and fat from her lower abdomen. You can barely see the scars, but there is an incision that goes from hip point to hip point, and you can see the scar that goes around the areola and down. And those nipple areolas, they are not real, they're 3D issues. I couldn't. That's like the new thing that is coming around. I'm really sorry I couldn't find any pictures that didn't have nipple areola reconstruction. So this is what you guys got. It makes you draw your eyes away from the scars. So that's the whole purpose of it.
Also another treatment for if you did develop if you do have the BRCA1 or 2 mutation, they can do chemoprevention to reduce the woman's risk of breast cancer, which would be the use of chemoprevention drugs like tamoxifen or raloxifene, where tamoxifen, if used for 5 years, it's been shown that it can reduce the risk of developing breast cancer about a third in pre- and postmenopausal women. And then the raloxifene, if it's taken for 5 years, it's also been shown to reduce the risk for breast cancer, however, in postmenopausal women. And the reduced risk is slightly less than tamoxifen, however, there are fewer side effects.
So I wanted to give you guys, kind of draw you as a picture. So example, like Jane was diagnosed with DCIS, which is ductal carcinoma in situ, at the age of 45. She underwent genetic testing due to a strong family history of breast cancer and ovarian cancer. She then underwent genetic testing for the BRCA gene mutation and was found to be a carrier of the mutation of BRCA1, which increased her lifetime risk for breast cancer to greater than 80%. And with this information, she opted to have a prophylactic bilateral mastectomy. And the surgery would consist of so she was diagnosed with right breast cancer. I didn't write it up there, but she was diagnosed with right breast cancer. So she is going to have a right mastectomy and a left prophylactic mastectomy. So it changes. Breast reconstruction consists of the following, however, not limited to immediate breast reconstruction, which means at the same time as the mastectomy, and I can't remember if Angelina Jolie did this. She got her mastectomy and then she started to have reconstruction, which is a delayed breast reconstruction. It's after you've had your mastectomy, you've had time to heal, and then you go back in.
Alright, now that we know how the gene mutation affects us, now we're going to talk a little bit about the actual gene. So the BRCA1 is located on chromosome 17, where BRCA2 is located on chromosome 13. And it's cytogenic, so BRCA1 is cytogenic 17q21. Again, chromosome 17 with base pairs between 43 million to about 43,125,482. Anyways, so the BRCA1 is located on the long arm at position 21. And then the BRCA2 gene is located at cytogenic 13q12.3. Those are the base pairs up there. And then it's also located in the long arm, however, at position 12.3. Here are some of the gene products from the BRCA1, BRCA2 mutations. So there's quite a bit. And then as far as the actual BRCA1 and 2 gene, everyone does carry this gene. It basically acts as a tumor suppressor gene where it, the protein that's produced, it'll help prevent cells from growing and dividing too rapidly or in an uncontrolled manner. It also will provide instructions to the protein that's involved in repairing damaged DNA. So it can help repair DNA as well. So the BRCA protein interacts with other proteins, for example, the protein RAD51 and BRD1 gene, which it'll help mend breaks in DNA. So pretty much the role of the BRCA1 and 2 gene, when it's non-mutated, it'll help maintain the stability of a cell's genetic information. So with the actual gene mutation, they have identified over 1,000 mutations with BRCA1 and over 800 mutations in the BRCA2 gene. So basically, the BRCA1 gene mutation leads to the production of an abnormally short version of the BRCA1 protein. Other BRCA mutations change single protein building blocks, which are the amino acids in the protein, or deletion of large segments of DNA. And the BRCA2 mutations insert or delete a small number of DNA building blocks, which are the nucleotides in the gene. And this results in an abnormally small non-functional version of the BRCA2 protein. And since they're both, if either one of those are mutated, since the BRCA genes help maintain the stability of the cell, because of the mutations, it will cause that instability, and eventually, also because it's a tumor suppressor, it can be affected and no longer suppress tumor cells, therefore leading to cancer.
Mode of inheritance is autosomal dominant inheritance, and it's a germline mutation. Either parent can pass on the BRCA1 or BRCA2 mutations. The father with hereditary BRCA1 or BRCA2 mutation passes it on to his children, and you can barely see, but the guy has a big B and a little b, and the woman has little b, and the first child, this one, has big B, little b, big B, little b, little b, little b, little b, little b. And they're at 50% of inheriting mutation regardless of the child's gender. The BRCA test is a genetic test that looks for abnormality in two genes called BRCA1 and BRCA2. BRCA stands for breast cancer susceptibility genes, and abnormality mutation in one of these two genes increases the lifetime risk of developing various of cancers, as shown in the tables that I've already showed you. Each gene in our body carries out specific tasks. Both BRCA1 and BRCA2 genes repair damaged DNA. People with abnormal BRCA genes are not able to repair efficiently. Over time, damages accumulate and lead to develop of cancer.
Any questions?
I have one, curiosity's sake. It was mentioned in the video that there's a patent held